Hello, friends. I welcome you to my YouTube channel Study Med with Dr. Roy. Today, we are going to study a very interesting topic on suturing materials. Let's start the video. तो suturing material क्या होता है? But before we start what is suturing material, we should know what is suturing. Suturing is a stitch or series of stitches made to secure a position of the edges of a surgical or traumatic wound. Apposition means closing or bringing close the this is some wound or any surgical incision made, so the margins of the skins are separated. So with the help of suture to approximate these margins together like this is called apposition. Okay, so suturing is a stitch or series of stitches made to secure a position of the edges. Like, see, these are edges of any surgical or traumatic wound. Now, why we do it? What is the purpose of suturing? First thing, already we knew wound edge apposition. Secondly, to maintain hemostasis, to stop the bleeding purpose. Third one is provide adequate tension. Fourth, aid in wound healing, to promote the wound healing so that the wound can be easily healed. Produce aesthetically pleasing scar. Like if there is any injury, by placing suture, we are ensuring that the scar looks good, the skin becomes normal. These are the purpose of suturing. Now, what is the criteria for classification of suture materials? So, for suturing, we will be using these materials. So, these materials are classified based on some criterias. So, we are now going to study those criterias. Physical properties. First thing is filament. Filament is the unit, means like multifilament or monofilament. We will further seeing what it exactly means. Second thing is tensile strength. Tensile strength can be defined as the strength of any suture or the weight bearing or force shearing capacity of any suture before it breaks down. Absorbability. It is the third point. Suture can be absorbable or non-absorbable. After placing the suture, either suture can will be absorbed in some time or it will remain as it is in the body. So based on these, suture could be absorbable or non-absorbable. So we have these three things. So for every suture material we are going to study onwards, we will be studying them in these points, whether the suture will be either monofilament or multi, tensile strength, absorbable or non-absorbable. Now this is the the labelings of suture material. So let's see here, this is what, and see this ethicon, this is manufacturer name, and what is this is brand name of the material. Now this is small thing which is written beyond, just below the brand name is suture material. What is the content? This is polyamide, and likewise other sutures. You can see here, this is the pickup. This is a point where we pick the sutures from the needle driver. This is the expiration date or the expiry date or the lot number. It is mentioned here. This is suture length, the length of suture, like 18 inches or 45 centimeters. This is image of needle made. In the last video, we have discussed different types of needles. If you haven't watched that video is pinned in I comment. You can go. If you haven't watched that video, you can go on the I button and watch that video to get basics about the suturing needles. So This is inverse triangle. Now we are going. We now we know what the inverse triangle means. This is reverse cutting. Here it is also mentioned that, like, if it will be like this, it will be conventional cutting. Like this, it is reverse cutting. It is like this, it is round body. So these are different things, types of shapes of needles we have studied in the last video. Okay, needle type, reverse cutting. Needle length, it is 19 centimeter. We have seen that this is, if this is needle, there are two types of length in any needle. This horizontal length, which is called needle cord length, and the second length, which is the circumferential length from tip eye to the tip or needle point, it is called needle length. Needle code, this is code, metric gauge and US gauge. Now what this size means, see this, large size, if 10, extremely fine, as the number will get increasing like this fashion, the fineness of the needle will go on increasing like this. It will get more fine, the suture material will get more fine. And what the number of zeros indicate, like zero have, what the number of zeros indicate, so it indicates a decrease in the diameter of and the strength of the suture. Okay, now 0, 0, 1, 0, 2, 0, 3, 0, likewise. Okay, so here we can see which suture is used for which purpose. Like for 0, 0, generally extraocular muscle isolation. 1, 0 are stay sutures. 2, 0 deep tissue fascia high tension. 3, 0 deep tissue fascia, like likewise skin deep tissue. 5, 0 facial skin. 6, 0 muscle eyelid skin. 7 conjunctiva eyelid skin. 8 sclera. 9 limbus conjunctiva. 10 cornea. 11 cornea nerve sheath. So the important thing is to understand the very basic concept what the this numbering actually means. Okay, if you have any doubt in this, you can ask in comments. Now we are further moving to the classification of suture materials. So we can classify suture materials based on the source of their procurement, or their fate, or their coating. And third, structure. Here we have one diagram also. According to the source, suture material could be obtained from the natural sources, it could be synthetic, or it could be metallic. So there are three types of suture materials based on the source: natural, synthetic, and metallic. On the based on the fate or absorbability, the suture material could be absorbable or non-absorbable. Third is coating, coated or uncoated, like plain catgut. It is coated, it becomes chromic catgut, called chromic catgut. Plain catgut is uncoated and chromic catgut is coated. Likewise, structure, monofilament, multifilament. As you can see in the diagram, this is the single filament that is comprising and making the suture material monofilament. When it is braided like this, there are multiple filaments you can see in the cross section like this. This is multifilament and braided. So, so now natural sutures. The suture material based on the sources, the natural ones, there are two types: absorbable and non-absorbable. Absorbable sutures, catgut. It is first example. You can see in the diagram. This is plain catgut. This is the needle. This is round bodied. This is suture length. This is half CRB. Absorbable suture. This is USP2, or like the numbering we have already seen. Chromic catgut. This is coated one. chromic acid. You can see in the diagram, this is the chromic one. Okay, so catgut was of this color, and when after getting coated, it becomes this. This is called chromic catgut, and definitely it is absorbable sutures. Third one is collagen, and fourth, living tissue like facial atta, etc. Non-absorbable silk sutures. These are non-absorbable sutures. You can see in the diagram, it's blackish in color, and non-absorbable sutures mentioned 3 by 8 circle reverse cutting. So this is what does 3 by 8 means. We have already discussed this concept in the last video. Okay, linen. You can see this is linen material. Then cotton. It's again non-absorbable natural suture. So in this, we have to study and memorize the names of the absorbable and non-absorbable natural sutures. So you can see there are triple C in absorbable natural sutures. Catgut, chromic catgut, and collagen. Okay, these three names you must know. Then silk, linen, and cotton. Like study or memorize cotton and silk together. Okay. Second, secondly, we are going to study now synthetic ones. We have studied natural sutures based on the source of procurement. Now synthetic ones that are man-made. Again, these are of two types: absorbable and non-absorbable. So first example in absorbable one is polyglycolic acid, or simply PGA. Okay, polyglycolic acid suture. You can see the diagram. This is the color of this suture material. These are the details. It is braided one like this. I have already told. Braided means it's multi-filament. All the filaments are very tight together. This is called braiding, and it is braided type. You can easily understand by poly. Poly means multiple. So that means multiple, and it is similarly multi. Just like you can memorize it like this way. Second one is polydioxanone, or simply PDS suture. A bit expensive one. The suture is a bit expensive, so it is very selective and less used. Then this you can see here. This is the numbering of the suture. These are the needle details, and this is monofilament, polydioxanone, violet sutures. You can see absorbable and synthetic. This is what we are studying. Synthetic, absorbable. You have studied polyglycolic. Now polydioxanone. Third one is polygalactin or Vicryl. Very commonly used sutures. Polygalactin and Vicryl. You can see in the diagram. The suture material, you can see this is again braided one. This means it is multi-filament. Okay. So among synthetic ones, polyglycolic was multi-filament, polygalactin was multi-filament, PDS is monofilament. Okay. Now this is again the needle parameters are mentioned here. This is the shape of the suturing needle. This Vicryl composition. This polygalactin. You can see. Okay. This is the manufacturer, and these are the suture material details. It is synthetic and absorbable suture. Okay. It's Vicryl. Polyglycapron or monicryl. See again the needle details, the length, suture. This is the pickup point where you will be picking the suture. This is the composition. manufacturer. So likewise, for every suture material packed, we will be seeing in this format. So we now know the absorbable category. Generally in absorbable we have the term poly in common, like polyglycolic, polydioxanone, polyglectin, and polyglycapron. Okay, so this on this way we can memorize it. Now second category is non-absorbable, which is simply nylon, or it is nylon means it is amide nylon. So here in the diagram you can see it is again black in color, and it is monofilament, and again non-absorbable suture. So this is what mentioned on the packet. If you will keep this diagram in your mind, you will never forget which suture belongs to which category and under which classification it is mentioned. So again, this is the needle parameters mentioned. It is again 0. That means the, the starting one is the reverse cutting. You can see the diagram. It is inverted triangle. Likewise. Second one is proline. You can see proline, the color of this proline suture material. It is blue monofilament. And again the 0 1, this is the size or the length. So like this way. Polyethylene, the third category. Okay, so nylon, the most common example belong of non-absorbable you should memorize is nylon and proline. Okay, nylon and proline you must remember, the most common example. Okay, now we are going to study the very basic concept, what the monofilament and what the multifilament actually means, and what is the significance of these suture materials in suturing. So monofilament is single stranded suture material. Okay, obviously we have seen it previously, it is single stranded. So since it is single stranded, so it will be showing some properties like it has no capillary action. This is the good point for any suture. It should show no capillary action, otherwise it will show soakage. Secondly, less infection risk. Since it will be absorbing less fluid from surroundings, it will show less infection risk. Third, smooth tissue passage. Okay. The fourth one is harder to handle due to memory. See, this is a single suture line, suture material, or single or made up of single filament. It will be having good memory. So when the suture material is removed from the packing, so maintaining its original shape, that's called memory. Since it has good memory, so to fix the suture on any tissue, we need more knots or more throws to fix that suture, otherwise it will show its memory. So hence it shows more throws are needed or more knots are needed. Better word is you can more knots are needed, and higher tensile strength. Examples of monofilament absorbable we've already seen: chromic catgut and PDS. Like in this diagram you can see among synthetic and absorbable, all were multifilament except PDS. Here is it is that's what it is written: absorbable PDS, chromic catgut. And non-absorbable, we have already seen two examples: nylon and proline. Okay, these are the common example you must remember: nylon and proline. Now, second thing, multifilament. Fibers are braided, means twisted together, like these are two fibers. So when they are cross-linked on each other, and will like this way. So this they will in braided and twisted together. This is the same thing. Since there are multiple fibers or multiple strands or filaments in this material, it will show capillary action. It will be absorbing some liquids or some discharges from the surrounding where it is sutured. So hence it will show increased infection risk and less smooth passage. And since it Now, it has very less memory, means it will lose its shape when it is removed from the suture material packet. So it is very easy to handle, and hence it is easy to that it is has less memory. It requires better net security and less throws, like less number of knots are needed. Okay, and net security is good, and less tensile strength of the suture in multifilament. Again, it is absorbable and non-absorbable. So in absorbable, it is Vicryl and PGA, polyglycolic acid. We have already seen PGA belongs to synthetic one, and Vicryl is also synthetic. See this, Vicryl and PGA, absorbable and synthetic. This is what it is written here. Now non-absorbable. We have studied two things in pair. These are natural sutures, okay? Natural ones. Silk and cotton. That is linen. Now, what is absorbability of suture? So, what is the concept of absorbability? So, we have seen every suture is either absorbable or non-absorbable. So, what this actually means? So, absorbability means the suture material after being sutured will be degraded by enzymes, hydrolysis or phagocytosis. Means it will get uh, absorbed, or it will get degraded by these processes. It could be either hydrolyzed, phagocytosed, or it degraded by the enzymes. Next thing, it is used to hold the edges in approximation temporarily until the wound is healed. Like if there is any wound, the wound edges are not approximated. So after we will make a suture here. So we this material will be dissolved in some time, and until these edges is approximated and this gap is filled. This is what they are saying. Non-absorbable, it is encapsulated or walled off by fibrosis. So this is important thing. It becomes a part of your body by means of fibrosis. Used to suture at sites where tensile strength need to be maintained. The very basic difference in the absorbability here, it was degraded by either hydrolysis, phagocytosis, or enzymes, while non-absorbable, it is encapsulated, walled off by fibrosis. Now classification. Now we are going to sum up what we have uh, learned in this video. Classification: the suture material will be absorbable or non-absorbable. Absorbable material suture materials could be monofilament or multifilament. Multifilament, that means braided one. Examples are plain catgut, chromic catgut, and Vicryl. Monofilament, PDS, monocryl. Now non-absorbable, multifilament and monofilament. Silk belongs to multi, and polyester again, and monofilament, the nylon and proline. These two examples from synthetic non-absorbable monofilament sutures. Nylon and proline. Study them in combination. Likewise, we have studied cotton and silk together. So likewise, study nylon and proline together. Thank you guys for watching this video. Hope your very basic concepts about the suture materials have been cleared. In the second part of this video, we will be studying the details of the respective suture materials we have studied, and what are the principles of suturing. This will be studying in the second part. If you want to get notes of the content we have studied, you can join my Telegram channel. The link is in the description box. You can go check in there, and see you in the next video. Thank you.